BNP and NT-proBNP. They are cardiac biomarkers. Cardiac biomarkers are the tools that assist physician in diagnosing heart failure, stratifying risk, and guiding the treatment. The BNP or NT-proBNP is the biomarker of myocardial stretch and left ventricular remodeling. When there is increased intracardiac filling pressure, there can be myocardial wall stretch, which results in release of large amount of prohormone BNP by the ventricular myocyte. It is secreted as proBNP, which is a protein containing 108 amino acids. This prohormone rapidly degrades into active BNP, which is a 32 amino acid containing protein, and NT-proBNP, which is a 76 amino acid containing protein. What are the causes of elevation of natriuretic peptides? There are cardiac cause and non-cardiac cause. Cardiac causes are heart failure, pericardial disease, left ventricular hypertrophy, myocarditis, valvular heart disease, acute coronary syndrome, and cardioversion. The non-cardiac causes are anemia, burns, critical illness, pulmonary hypertension, renal failure, severe pneumonia, and toxic metabolic insults. There are cutoff levels for diagnosing heart failure. The values to rule out heart failure in chronic breathlessness are NT-proBNP less than 125 picogram per ml and a BNP level less than 35 picogram per ml rule out heart failure. In acute breathlessness, a value of 300 picogram per ml of NT-proBNP and less than 100 picogram per ml of BNP will rule out a heart failure. If patient is presenting with acute dyspnea and we are getting a value above 400 nanogram per ml of BNP, we can diagnose a heart failure. Between 100 to 400, it is a gray zone in which we need additional test to rule out heart failure. When there is acute dyspnea, when we consider NT-proBNP, age should also be taken into consideration. When age is less than 50 years, a NT-proBNP less than 450 can be considered to rule out heart failure. When 50 to 75 years, the value is less than 900, and when the age is more than 75 years, the value is less than 1800. Comorbidities also should be taken into consideration. When the GFR is less than 60 ml per minute per 1.74 meter square, the BNP value less than 200 can be taken into account to rule out heart failure. NT-proBNP of less than 1200 can be considered to rule out heart failure. BMI also should be considered. When the BMI is less than 25, BNP level less than 170 is considered to rule out heart failure. When it is 25 to 35, it is 110. When BMI is above 35, less than 54 can only be used to rule out heart failure. BNP and NT-proBNP is used as biomarkers to diagnose and grade the severity of congestive heart failure. Recent studies also suggest that these enzymes can be used as a biomarker of myocardial ischemia also.